If you are going to a restaurant, and it's overcrowded, it's probably going to be not as safe as if they are actually following the 6-foot rules.
That's Dr. Paul Thomas, who's here to answer your questions about coronavirus.
And this is your Daily Detroit for Friday, July 3rd, 2020. I'm Sven Gustafson.
And I'm Jer Stays. Let's catch up with Dr. Paul, then a couple of things to know around town, and we'll finish with a check-in on how we're feeling. Joining us is Dr. Paul Thomas from Plum Health. Welcome back to the show, sir.
Thanks so much for having me on. Great to be here.
Well, we have collated a ton of questions from listeners, and we have some ourselves about coronavirus, COVID-19, everything that's happening, because it just seems like there's just a lot of uncertainty out there. And from the listener response, we know it's real. So, Sven, why don't you kind of kick this off? We're just going to get right to it.
Yeah, thanks, Jer. This question I feel like is very much topical. We keep hearing about it in the news, and that has to do with masks. And I profess to some confusion of my own on this matter. And the confusion is this. Do we wear masks because they protect other people from us? Or do we, gain protection from others wearing masks? Or is it a little bit of both?
It's a little bit of both, but the majority of the protection comes from the person who has coronavirus and chooses to wear a mask to protect other people. Mm-hmm. And here's the thing. It's difficult because there's such a long prodrome for this condition. You have the virus and you don't know that you have it. You're an asymptomatic carrier, and then maybe 3 or 5 days after contracting the virus, you start to have symptoms. They're finding that most people are spreading the most virus before they have symptoms. And so in that prodromal period or that incubation period. And so that's why it's imperative for everyone to wear the mask, because we just don't know who has the virus because they may not have symptoms yet. And then on the other side, you wear the mask to protect yourself from other people who are speaking near you or talking to you, because a lot of the transmission comes from droplets, speech droplets. When you're speaking, saying phrases or talking to other people, those droplets can go into the other person's nose or mouth. And so wearing a mask can protect you as well from inhaling some of those droplets and getting the coronavirus that way.
So continuing on with the questions, Jay from Detroit wrote in, I thought masks were the silver bullet. Why are cases going up even in Michigan?
Well, because not everyone is wearing a mask. And just like we saw with the Harper's scenario, Harper's in East Lansing, a lot of college-age students went to the bar and there were signs that said, please wear a mask. But in the photos, no one was wearing a mask. And I think there was even like photos from inside Harper's that showed that people were just not wearing masks. And they're talking to each other loudly, forcefully. That expels more droplets when you're in that crowded, loud place. And then they're close to one another, violating those 6-foot social distancing rules and spreading the virus that way. And that's a common scenario, unfortunately, as people are really wanting to go out and socialize. But this is not over yet. We're seeing more cases, not as many as Florida or Texas or other hard-hit states right now, but we are seeing more cases in Michigan. So it's important to continue to wear the mask and follow the social distancing rules.
Speaking of the bar in East Lansing that's been tied to the outbreak, Andrew writes from Macomb County and asks, why did the governor think closing down indoor bars is a good idea? Why are we killing jobs to stop the virus? Is it really that bad?
It's unfortunate that some bad actors have prompted a statewide closure on indoor bars, because if people were following the rules, if Harper's mandated that everyone wore a mask, or if other bars had people socially distance themselves within the bars, then we wouldn't be in the situation where we're having to close down bars. And it is worth, protecting the lives of people in Michigan. And we're really at a point where we have to follow these rules in order to stop the spread of the virus. It is a good idea to close down the bars if people can't follow the rules and can't learn from our past.
Phil from Oak Park asks, if I happen to forget my mask when I leave my house, should I go back for it, or am I protected if I maintain social distance?
Yeah, it depends on what you're doing. If you are mailing a letter at the post office and you just have to slip in and slip out, You're not going to run into anybody close by. Maybe you could get away with it. But if you're going to the grocery store, you should definitely wear a mask, or other crowded indoor areas, you should definitely wear a mask. And it's just, again, it's common courtesy. You may not know if you are an asymptomatic carrier, and so you don't want to be the one infecting other people. And at the same time, it's not really worth risking it, especially if the inconvenience to you is 2 or 5 or 10 minutes of going back to the house and picking up your mask. The real solution here is to keep cloth mask in your pocket and a cloth mask in your glove box. And that way, if you're ever out and about and you forget it, you'll just have an extra one in the glove box.
Yeah, I'm really trying to kind of incorporate it into my, checklist as I walk out the door, no matter where I'm going, like along with, the basics like wallet, keys, phone, don't forget the mask, that kind of thing. Even if I am just planning to be outside, because you never know when you might want to duck in like, oh, I'm really thirsty, I need to go buy a bottle of water or something.
Exactly. And that's why, just make sure you have one in your purse or in your glove box or in your pocket so that you can protect yourself and protect other people.
All right. Todd from Canton asks, why do bars have so many cases from them and protests do not get them reported? I think what he means is, we don't seem to be hearing about outbreaks that are tied to all of these protests we've been seeing.
And that's a great question. I think a couple things. One, the protests are outside, and the vast majority of protesters have been wearing masks, and they've been marching spaced out from one another. If you saw any of the protests here in Detroit, you saw that people were generally keeping their distance from one another, with the notable exception of Governor Whitmer and some of the other political leaders who came out that one day and kind of congregated together. That aside, the majority of the protesters that I've seen have been keeping social distance. They've been outside for the entire time and wearing a mask. Now, contrast that with a lot of bars. They're crowded areas. People are speaking without a mask because it's really hard to drink a beer or drink a cocktail with a mask on, so people are not wearing their mask in these settings. And then they're speaking loudly to one another. And we're finding that the primary way that this virus is spread is through respiratory droplets, or speaking to other people. You're spreading the virus that way. So it just makes the bar scene a very ripe way to catch this virus. Another thing is it's easy to track these people because you can find out who is at the bar just by contact tracing. And then these things spread. Like a young person who was at the bar in East Lansing went to a house party in Grosse Pointe, like a backyard bonfire, and then infected like a score of, maybe 10 or 20 other people. And it's easy to trace that way.
Which, you talking about like people being outside and marching and maintaining social distance. Some other chatter that I've been starting to see pop up lately has to do with beaches. I mean, it's summertime, it's getting hot out. Everybody's, restrictions on traveling are being lifted. So people are traveling up north to go to the beaches and everything. I mean, I talked about being at the beach last week, earlier on the show this week. We spent a couple days on the beach at Lake Michigan, and there were a couple moments when I looked around and I said, okay, all these people are more than 6 feet apart from all these people I don't know, but still there are a lot of people here, and it gave me a little pause. I mean, are beaches safe?
Yeah, again, it's just going to depend on how close you are to other people. Are people wearing masks or not? And, if you have your own designated space or area at the beach and there's not a lot of people walking through your area or getting too close to you, then it's probably a safe thing to do. But if it's overcrowded and there are a lot of people nearby, then it becomes less safe. And I think we can apply that to pretty much any situation. Like if you are going to a restaurant, and it's overcrowded, it's probably going to be not as safe as if they are actually following the 6-foot rules and, seating people outside and only having a couple tables inside, et cetera.
So it really sounds like an idea of situational awareness is really key. And I know we've got some more questions to go here, but it seems like there is this theme of, I can't really tell you X or Y is for sure safe, but I can tell you what are the situations that are less safe and more safe. It's something where you've got to kind of think about it as you go along.
Exactly. And I think we're all pretty smart here in Michigan, and we know when situations aren't safe and what situations are safe. And, it just kind of takes you a couple seconds. Maybe you had a reservation at a restaurant and then you get there and it's overcrowded and you see that there's too many people there. It looks like a wild environment. Maybe that's something you bow out of gracefully and say, listen, this isn't the place for me. I could get sick or potentially get somebody else sick. It'd be better just to eat at a less crowded restaurant. Or you go to the beach with some friends, you realize that the beach is super crowded. Maybe that's something you back out of and go, a mile down the road to the next beach or whatever it might be. And I think the real trouble here is we're finding that there are more and more younger people who are out and about and maybe not thinking as critically, or maybe just going along with friends because they want to socialize, which is understandable. But I think that's where the majority of these outbreaks are coming from, these younger people who have been pent up for so long and wanting to get out and enjoy summer, so to speak.
Yeah, speaking of being pent up and people going to beaches, I mean, people are obviously returning to restaurants. And we got a lot of questions about your thoughts about how safe it is to eat out at a restaurant, and what kind of things would you recommend people look for if you're sizing up places to eat? I mean, I talked about being in downtown Ludington, and I saw a restaurant where the bar, it was open air to the outside, but it was an indoor bar, and it was packed elbow to elbow with people not wearing masks. And right then and there, I said, well, we're not going to eat here.
Yeah. Yeah, I think, just sizing up the place. I mean, I went out to a couple of restaurants in Detroit over the past 2 weeks, and we were really happy because they were following the guidelines and had tables 6-8 feet apart from other guests. So it felt like a safe and comfortable space, not overcrowded. And, it felt good going there and supporting the local businesses because I know they've been shuttered for so long. And I think everybody wants to do that, but you have to, pick where you can go that's going to be a safe place, that's going to follow the rules. The other thing you could ask about is what kind of air filtration systems do they have? I know some businesses, restaurants are installing different high efficiency particle air filtration systems. And then, this is kind of something that came out of China, but they showed that the restaurant had set 3 different tables between an air conditioning unit, and the forceful air that was blown between those 3 tables ended up spreading the virus to patrons at other tables. So part of it has to be on the restaurant owner to be aware of these systems and situations. And then the other part is on the patrons to not overcrowd the bar and make it an unsafe area.
So my next question is Christine from Oakland County. Airplanes, is it safe to board them? Should we fly?
Yeah, only if you need to. I mean, if it's an emergency, like you have a sick family member across the country and the only safe way to get there is by plane, or if there's some other emergency that's coming up that you have to go maybe to another state for a medical treatment or something like that. But if you're just planning a trip to Florida just to go to Florida and lay out on the beach, I would not recommend flying at this point. And that's because there are so many people on these flights, and it's a great place to catch the coronavirus because you have people traveling from all over and in an enclosed space, especially if you're sitting in the aisle. They found that people who are sitting in the aisle are more likely to be touched by other people or touch more surfaces. And those sitting in the window seat or the middle seat are more likely to stay seated for the whole flight and therefore more protected. So if you must fly, pick a window seat, wear a mask, wash your hands. And then once you put your mask on in the plane, don't take it off. Don't fiddle with it. Don't take any drinks or eat anything during the flight. That's the best way to protect yourself. And again, a lot of these planes have those high efficiency particle air filtration systems that may pull out some of the virus from the air. But all the same, it's a crowded space. And if it's not necessary, I would definitely advise against it.
Here's something that's kind of newsworthy. We've seen stories in the news about certain events that are asking attendees to sign a COVID waiver of liability. For example, the NFL is apparently considering asking fans to sign a COVID liability waiver if they want to attend a football game later this season. So Phil from Oak Park asks, what should I consider before I go anywhere that makes me sign a COVID waiver to enter or attend?
Yeah, I mean, I think it's a really clear sign that if you have to sign a waiver, that means your likelihood of catching the virus is moderately to relatively high if you are going to that event. Because what are people doing in sports stadiums? They're standing, they're cheering, they're high-fiving one another, they're yelling.
Sitting right next to each other. Mm-hmm.
Yeah, exactly. And, again, we talk about this, how we spread the virus, and it's through these, respiratory droplets, particulate matter from your mouth and lungs that you expel when you speak normally. And so people are going to be yelling at the top of their lungs at a sports game, and it's a great way to spread the virus to other people. So if you have to sign a waiver, it's probably a good indication that it's an unsafe space. Just like, this was newsworthy, the Trump rally.
Yeah.
All the attendees had to sign a waiver because they knew that this would be a great place for the virus to spread, and they didn't want to be liable for anybody catching the virus and then blaming the Trump campaign. So, I mean, if you have to sign a waiver, you should really be thinking twice about going to that event.
All right. Another question that we've had is, what are some of the lasting effects that we're finding of COVID-19, if any? Some people say it's just like the flu. Other people report that it takes a long time to recover. Like, can you talk a little bit about that?
Yeah, so this is certainly evolving. We don't have a ton of great evidence at this point, but we're seeing that some people have prolonged symptoms, prolonged shortness of breath that gradually resolves over time. Some people have anosmia, where you lose your sense of smell for a long period of time because the coronavirus directly attacks the olfactory cells, or the cells you need for your sense of smell. But, this is a medical issue, and to figure out medical issues and how they affect a population, it takes years of study, at least months of study, and we've really only been acquainted with this for the past 6 months. There's some data coming out, but it's not robust enough to say, oh, you'll definitely have this if you catch the coronavirus. Hopefully most people recover with a normal functioning, just like you would after the flu or after other viruses that you might get. But we'll see what happens. Probably in another year, we'll have more data about this.
Well, and real quick, I wanted to add on to that. The listener, Tony, and there's a couple other folks who talked about this, is that they feel like they have no idea kind of like the consistency with the messaging. Like they feel like health officials have been inconsistent with their messaging over time and that they could be a lot clearer. My gut tells me with what you're saying is that we're learning things. So we have to be open to the idea that as we get new information, the recommendations may change.
Exactly. And, we've seen that happen even around masks. The CDC came out and said, don't wear a mask. And the reason that they said that is they didn't want people buying and hoarding all of the surgical masks and N95 masks. They wanted to have enough of those available for health professionals. And then they changed it, weeks later by saying everyone should wear a mask. And really what they should have said is everyone should wear a cloth mask and make sure that you give your surgical mask or N95s to healthcare professionals. And I'm sure we'll see a lot of things change over time. Like we've seen a back and forth on different medications. Now they're saying a steroid might be helpful in decreasing the severity of symptoms for coronavirus. And it all remains to be seen because, first of all, you can't run active experiments on active people. It's just unethical to have a treatment group and a control group because for obvious reasons, you just can't do that. So we're just learning from what's been done in certain places and comparing that to the overall population. It's really hard for clinicians and scientists to figure out exactly what the best treatment is because you can't have like a control group and an experiment group because that's unethical.
Well, then, and finally, before we let you go, I wanted to ask you about data. It seems like it lags a few days or longer. And how much of a lag are we really talking about here between cases, hospitalizations, and deaths? Because it seems like it's something where it's a snapshot, but what we see in the cases today or in deaths and things like that is kind of a lagging indicator of what is happening out there with the virus. Do you have any idea on data and what people can kind of keep in mind when they look at this stuff?
Yeah, if you just think about the natural disease course of this virus, it takes maybe 2 to 5 to 7 days for you to become symptomatic. And so then once you get symptomatic, you're probably going to go get tested and your result may not be back for another 7 days or so. So that might put a 1 to 2 week delay on somebody actually getting the virus and testing positive. And then maybe 10 days later or 2 weeks later, their symptoms may be severe enough where they need to go to a hospital for treatment. So you might be looking at a 2 to 3 week delay on hospitalization. And if someone were to die from this, unfortunately, might be another delay on that reporting. So there is a lag here and it has to do with the natural course of this condition. So there's a lot of things to consider there.
All right. Well, Dr. Paul, we know you got a busy slate as a doctor who administers to his patients. So we really appreciate your time and your willingness to answer the burning questions that are on the minds of our listeners. Thanks so much.
Thanks for having me on. And I hope this helped everybody understand this a little bit better. And I appreciate you taking the time to ask me the questions.
So a couple quick coronavirus things to know. Numbers are up statewide. We had the highest number of confirmed cases in a long time on Thursday, and we're seeing hot spots across Michigan. There were 543 new cases the day we recorded this, and we are in for more. And there were 15 deaths. A vast majority of those are due to a record-keeping update. So far, we've had nearly 64,700 confirmed COVID-19 cases, nearly 6,000 deaths in Michigan, and the reproduction rate of the virus is still 1.23, which means it is growing.
We have some good news from Henry Ford Health System, which has been doing a study on hydroxychloroquine, which is a drug commonly used to treat malaria. It's been in the news a lot. The president has touted it and said he was taking it himself personally. Researchers there at Henry Ford found that hydroxychloroquine reportedly lowers the death rate of COVID-19 patients. They did a study of more than 2,500 hospitalized coronavirus patients and found that 13% of those who were treated with hydroxychloroquine died, compared to double that rate, 26%, for those who did not receive the drug. This is interesting, Jared, because I know some other studies have found contrary findings, or at least have found that there was no perceived benefit for using hydroxychloroquine.
Well, it seems like the benefit really happens in the more desperate situations, when you're kind of already in the wicket, as opposed to as something that would help protect you. All right, Sven, we have been in this for weeks and months now. Man, we don't always get into this, but it's the holiday weekend. We're going to kick back and spend some time with the people we love. How are you feeling?
Well, before I answer that question, I would point out that you and I are both probably, dusting off the cobwebs a little bit. We're recording this kind of early in the morning for us anyways, and the morning after the Fizz Fight 2020, where we recorded our taste test of Michigan-made hard seltzers in your backyard, and that was a good time.
Oh, it was, and it was good to socially distance see people, though. I will say that you took the most absurd picture of me I think there's ever been done.
I'm itching to share that one out on social media, with your permission, of course. But yeah, that was good for a pretty hearty laugh. I will say that. The whole night was, frankly, because as listeners will discover, I am not a fan of hard seltzer.
No, not at all. And I feel like it's a unique look to have headphones, a mask, and a recording device at arm's length.
And a pineapple shirt, too.
Oh, listen, I love my pineapple shirt.
Oh, I know. It's a great shirt, but with the black mask and the headphones and oh, my God. I just couldn't help. I just lost it.
It's like the intense engineer look.
Yeah. But anyway, back to your question about how are you feeling. I've been thinking about this a lot lately, and I actually feel surprisingly good. And I say that because I'm someone, I've wrestled with depression at various points in my life. I can definitely, look, as I think anybody who reports news for a living like we do and talks about heavy issues, it can weigh on you, but so I say that in the sense that I'm almost surprised sometimes how good I'm doing. And I recognize, I have to qualify that I recognize I have things good. I've got a family, my wife, my two children. I'm extraordinarily blessed, I guess, to have them. And in, this time, I think this is a time where we need companionship. And it's hard, obviously, to have companionship if you don't have immediate family who you live with and everything. But, we got to stick together. And, I will just share really quick. I mentioned that last week I was on vacation. I had a interesting experience when I was coming back, because we drove home and I, get to Ferndale, and my boys wanted to go by the skate park just to see who was there. And, whatever, I think they just wanted to see because they hadn't been there for a week. And we're driving through Ferndale, and I'm seeing everybody, with flags and yard signs, rainbow flags, and all kinds of, we've been talking about all the proliferation of symbol flags and how confusing they're starting to get. But everybody's got flags and yard signs out, Black Lives Matter, everything like that. And the streets were filled with people walking and riding bikes, which really made me appreciate after a week away, like this town that I live in, and like how much I love it. And I also love, in a way, like I don't want people to misconstrue this, but I love the transformation that I think has happened since quarantine, because people are out walking and biking, and you always saw that to a certain degree, but it has really exploded during coronavirus, and car traffic has diminished and everything, and it just made me feel really grateful. So what about you? Yeah, like how are you doing?
I mean, I hear all you're saying. On the other hand, like, I feel lonely and on hold. Like, I feel like, and I'm in a little bit of a different situation, here. I do have a roommate, but, here at the North End headquarters. But no, I mean, this has been, I've seen a lot of this padded room the last couple months. And it feels like, whether it's what we've been starting to get going here with Daily and really kind of get the wings behind it, and it's been great. I mean, we've had more listeners than we've ever had in the last, and it's crazy and it's gratifying, and
it's awesome.
It's awesome, but it also helps me get through, because like it's lonely. Like, this is it feels like my life's on hold. And as somebody who is at my stage of life, I've never been married. I don't have kids. It's not that I didn't want those things; it's just they didn't work out. And it's you're kind of stuck. You're just kind of here, and you wonder when it's going to end. And then you realize, when you do the reporting and you talk to people, it's not ending, and it's not ending tomorrow. And we didn't do shit.
Yeah.
And for a lot of folks out there, it's. I mean, I'm fortunate. I've got a great new dog. I've got a great old dog. I've got a great, roommate. We have the yard. We have walkability. You can go around and see people socially distanced. But like,
and you've got a tight knit neighborhood there too, like with lots of cool neighbors who watch out for each other.
Oh, absolutely! Shout out to the guy with the United Federation of Planets flag. But like, let your nerd flag fly. I love it. But it's also different than like having people and being around. And I am an extrovert at heart. And, it's like, it was real the other week when I thought about like, oh, what's it like to go back to those old things? And those old things aren't there. And I think that's the thing, the opportunity. Like, where do you go from here?
Mm-hmm.
And I don't want to be, the frustrating part is I don't want to be in the same part and the same place a year from now. And I really had like kind of made some thoughts that 2020, after 2019, just kind of spiraling, starting one way and really hopeful, and thought one thing was going to happen. And then at the other end of it, completely not. And then to be here, it's hard. It's lonely. It's something where you throw yourself into your work because you got to have something.
Yeah.
I can't imagine not, for me. I mean, if I didn't have work right now, didn't have all of you, I don't know where I'd be. This is like, I was talking with one of our contributors, and we're going to get into this later for another thing, but the idea of like the 5 stages of grief. And I think that's where we're at here with coronavirus. Cause I don't know. I look at the numbers and I realize we lost, and we lost a lot. We lost against the virus because we decided not to take it seriously as a nation. We decided to like puff our chests up. And we lost because, like, I'm not getting these next few months back. Like, I'm not. And a bunch of us aren't. And we aren't because we decided not to do the thing. And that's just heartbreaking. Like, it's so heartbreaking. And it's so, I don't know, man. I don't know. I mean, I'll keep going. We'll keep going. And everything has to keep going.
Yeah. But what else can we do?
What else can we do? But, like, it just sucks. That's all I got to say. It just sucks.
Yeah. Well, hey, I feel for you, brother, man. I think about you down there a lot because I know it's not easy, and so whatever I can do for you, man.
I appreciate you, and I appreciate our listeners. All right, that's it for this week's show. Thanks so much to the people behind the scenes who make this thing happen. Randy Walker, Cheyenne Nocerini, Fletcher Sharp, Devin O'Reilly. Special guest this week, Dr. Paul Thomas, of course. Thank you so much for spending your time with us. And of course, Sven, thank you so much for all your work on this. I know we're all juggling a ton of things, and your time is greatly appreciated.
happy to do it, man. Thanks to all of you for listening and for your support. Have a great 4th of July holiday weekend. And until next week, I'm Sven Gustafson.
And I'm Jairus Days. Take care of each other, and we will get through this together.